Hi, this is Dr. Brueck coming to you again with our basic introductory series on cosmetic procedures. The procedure I'd like to talk to you about next is an upper lid bleph and a brow lift. Now again, if you're contemplating surgery, you can call our office at 239-244-2329 and schedule a complimentary consultation. And at that time we can discuss the procedures that you're interested in and discuss your particular needs. Now, what is an upper lid bleph? An upper lid bleph is an operation that we perform to remove excess skin from the upper eyelids. Now, most people will have a fold of skin up there, they'll have excess skin, and sometimes that excess skin can impair your vision, in which case insurance may cover the procedure. I like to call it the visor effect. Like, for example, when you put a baseball cap on, you've got that visor. When you take your cap off, all of a sudden the sun is glaring in your eyes and you're squinting. That's kind of like the visor effect. So as we age, we get extra skin and it creates a visor or hood over our eyelids. So by doing an upper lid blepharoplasty, we can remove that excess skin and make our face look more youthful, more energized, and also at the same time it has a functional benefit in that it improves our vision. Now, I think it's important to understand when you're contemplating an upper lid bleph, you also take into consideration the eyebrow. Now, sometimes the eyebrow droops too. That's part of aging. Sagging, ptosis, call it whatever you will. And if the eyebrow is way down, you may need to have a brow lift. Now, what a brow lift does is it will elevate the eyebrow. So in many cases, we will do a bleph and a brow lift. So they're complementary procedures. Most of the time we do the bleph, and I would say 40% of the time we'll do a concomitant eyebrow lift. Now the eyebrow lift, again, will elevate the eyebrow, so you increase the space between the eyebrow and the eyelashes. So it's a very, very common procedure, and in many cases it's done with insurance, because insurance will provide coverage because there's a functional component to it. Post-op, it's very it's not an uncomfortable procedure at all. Again, what I tell patients to do is after the surgery, and it takes about an hour to 2 hours depending on whether you're doing one or both. When you get to the recovery room, we put you in the recovery room, and there you're there for maybe an hour, hour and a half, and then you go home. And when you go home, it's very simple. You go home, put your head above your heart, you put ice compresses on your eyes, keep your head elevated. You don't want to bend over, because when you do bend over, what happens? Blood rushes to your head, and then you increase bruising, you increase swelling. So it's important to keep your head elevated and keep ice on there as much as you can. Now, a lot of times people say, well, should I put ice on there 10 minutes, 4 times a day? Do it all day. Where are you going? And a note is, many times people will ask me, when can I drive? I think it's important that when you do decide to drive, that you don't have a lot of bruising and swelling around the eyes, because God forbid you get in an accident, it may be a situation where you have to prove that your vision wasn't impaired. So I think it's important to be very careful when you do drive post-op, that you do it carefully, because you don't want to have a situation where you go ahead and have impaired vision. Now, most patients will have the surgery one day, and the very next day they can go home, they can shampoo their hair, get everything wet. Again, I recommend that the patient get a baby shampoo, so that if they do get soap in their eyes, they don't rub their eye and tear out all the sutures. So that it's very, very important to go ahead and get a baby shampoo. You can blow dry your hair. So again, for the first 4 days, head up ice. From 4 days to 3 to 4 weeks, let comfort be your guide, and after a month you can pretty much resume normal activity. Now, what do I need to do preoperatively? Again, like most cosmetic procedures, I think it's important to stop all herbal supplements, certainly any aspirin containing compounds or any compounds that may cause bleeding, such as ibuprofen, at least 2 weeks before. And again, smoking, I've discussed this with all my patients. You should quit smoking 2 weeks before and wait at least 2 weeks so all your stitches are out to go ahead and resume smoking. And hopefully, if you haven't done it for 4 weeks, you won't be doing any more smoking. So I think it's really, really important that you do this. Now, what do I need to do in addition to preparation? We, again, like to have all of our patients go ahead and get preoperative clearance, have you see your primary care doc, maybe get basic lab work, possibly an EKG or chest x-ray, and address any medical issues that haven't been resolved or are ongoing. And then once that's completed, once that's done to our satisfaction, we schedule the surgery. Now, what are risks or possible complications with a blepharoplasty and or a coronal? Again, you can have bruising, swelling, infection, bleeding, scarring. One complication that can occur with a bleph is what is known as corneal abrasion. As you're stitching the eyelid shut, if a suture inadvertently rubbed across the cornea, you can get a corneal abrasion. And what we normally do is we can go ahead and patch the eye, give you some eye ointment, and usually in 24 to 48 hours that will heal and not be an issue. There can be excessive tearing or dry eyes. Now, many times patients will come in and they will have a pre-existing condition for dry eyes, and an upper lid bleph and or coronal may exacerbate that condition. So if you do use eye drops or eye ointments, we strongly urge you to continue to use that post-op. Another complication, potential, very rare, I can't recall the last time it's happened, and that's called lag ophthalmos. It's a long word, and what it means is when you do the bleph and you take away the skin, you have to leave enough skin there to get adequate closure of your eyelid. So we always are very cautious, particularly if somebody's had this done before, to avoid that complication. But in the end, it's a great operation. It's not one that's fraught with a lot of pain or discomfort or anything of that sort. It's a great procedure. And I think, again, you come in, we get it evaluated, and perhaps it's something that insurance will cover.